Well, good morning.
Good morning.
I'm very pleased to be here at the federal government's United Center Community Vaccination Site with Bob Fenton Jr., the acting administrator for the Federal Emergency Management Agency, with Adjutant General of the Illinois National Guard, Major General Rich Neely, Brigadier General James G. Silvasi, our Illinois Air National Guard Chief of Staff, and he's here on behalf of the Department of Defense. The Illinois Department of Public Health Director, Dr. Ngozi Ezike, Illinois Emergency Management Agency Director, Brigadier General Elisha Tate-Nadeau, Chicago Mayor Lori Lightfoot, Chicago Department of Public Health Commissioner, Dr. Allison Arwady, Cook County Board President, Tony Preckwinkle, and Cook County Health CEO, Israel Rocha, State Senator Patricia Van Pelt, State Representative Lakeisha Collins and Omar Williams, Cook County Commissioner Dennis Deere, and Alderman Walter Burnett. I also want to recognize the incredible people who worked without fanfare behind the scenes to make this moment possible, building out one of the nation's largest vaccination operations in just a matter of days. To the teams at FEMA, at the Department of Defense, and the city and the county and state health departments, you've put together an amazing enterprise, and Illinois is so grateful for it. I'm reminded that just 11 months ago, the mayor and I, together with the Illinois National Guard, the Department of Defense, and FEMA, launched an alternate care facility at McCormick Place when there appeared to be no end in sight to the illness and hospitalizations facing Chicagoans. Today, here at FEMA's United Center mass vaccination site, we mark the first round of vaccine shots slated to reach up to 6,000 Illinois residents every day. That will help build on our current state average of more than 90,000 shots put in arms every day, a number that's already growing every week. I'm grateful for this incredible investment by the Biden-Harris administration to vaccinate communities most affected by COVID-19, to focus on equity and on vaccinating more seniors all across the state of Illinois. In the initial senior exclusive sign-up window, more than 43,000 residents 65 and over secured life-saving appointments for the coming weeks. Let's not forget, those doses are all in addition to our existing state and city vaccine allotments, meaning the United Center expands the supply of vaccine available to Illinoisans. What's more, FEMA has committed additional support to deploy federal mobile vaccination teams to communities outside of Cook County hit hardest by COVID-19. And thank you to the administrator for committing to that. At the state level, IEMA, IDPH, and the Illinois National Guard are leaving no stone unturned in expanding vaccination accessibility for all Illinoisans, especially our most vulnerable residents. Between our state-run mass vaccination sites and existing mobile vaccination teams, the Illinois National Guard is supporting more than 60 vaccination locations each day. And there are more than 850 in total across the state. And to ensure nobody is left behind, we're targeting additional state resources to counties with lower vaccination rates, with National Guard teams deploying today and tomorrow to Grundy and Rock Island counties. I want to thank our Adjutant General, Rich Neely, and all the men and women of the Illinois National Guard. You truly make us proud. I hope you'll all give them a round of applause. To date, Illinois has administered more than 3.4 million doses to our residents, including at least the first dose of vaccine to nearly 1 in 5 Illinoisans. Cases, hospitalizations, and deaths from COVID-19 have fallen far below our winter peak, and Illinois' statewide positivity rate is at an all-time low. We aren't out of the woods yet, though, so I want to remind all Illinoisans to mask up and to stay safely distanced until we can get people vaccinated across our state. We're getting closer, every single day to the end of this pandemic, but we're not there yet. So I want to thank all of you, and with that, I'd like to turn it over to Acting FEMA Administrator Fenton.
Well, let me start off by thanking the governor and also other key officials here, Mayor Lightfoot, President Preckwinkle, Senator Van Pelt, Representative Williams, Commissioner Dennis Deere, and Alderman Burnett, including Major General Neely in being here. Also, I'd just like to thank the United Center and the families, the Reinsdorf and Wirtz families, for partnering with us on this facility. What a great facility to be here today and to be able to use this facility, and want to thank you for doing that. One of the things that we talk about is a whole community effort, and that's what's going to take, is a whole community effort to defeat COVID. That means not only all levels of government coming together, but private sector coming together like you see happening here today, and community-based organizations and faith-based organizations to be able to vaccinate everyone. And we will partner across all those organizations to make sure that everyone has an opportunity to get vaccinated. On January 20th, the President implemented his national strategy for COVID and pandemic response and preparedness. And that strategy that President Biden implemented was focused on ensuring that every individual has an opportunity to get vaccinated. And so FEMA was asked to partner with CDC to implement that strategy, or parts of that strategy. And we're doing that in a number of ways. First, we're providing funding directly to states, local governments, tribes, and territories across the United States. And in less than 50 days, we've already provided $4.2 billion to over 49 states, territories, local governments, and tribes. And also, the president changed the cost share from 25% to 100%. So there should be no limitation on resources to get everyone vaccinated. The second thing that he did was he went ahead and tasked us to change the cost share to the National Guard to 100%, so that each governor could fully utilize his or her National Guard to be able to respond to COVID or to help individuals get vaccinated. It's good to see the National Guard here with Department of Defense assisting in the vaccination mission. In addition to that, across the country, since January 20th, we've established over 700 sites that are new sites to help vaccinating by providing federal personnel, resources, equipment, supplies, or funding to stand up those sites. And lastly, we're working at establishing community vaccine centers like the one here today. This is one of 17 that we stood up that can process up to 6,000 vaccines per day. The major focus of this center is not only to effectively assist people in those areas, but to also focus on the Biden administration's focus on equity. So one of the things we've done is to pick the site and the other 17 sites, we use the CDC's Index for Social Vulnerability and use that in large population basis to go ahead and direct us on where to establish sites like this. So this is how we came to Chicago to establish this site. And FEMA has partnered with federal, state, local government to bring together all the resources and able to primarily federally support the vaccination efforts here. The key is to ensure that these sites provide vaccine to the most affected, the most vulnerable, and ensure that they get vaccinated. FEMA has deployed a civil rights advisory group to help with that, and we are working across the country with states and local governments to ensure that we work together to not only identify those groups, but to work with faith-based organizations and community-based organizations to ensure that we reach out to not only have people come to these sites to vaccinate, but also to extend mobile capability to other areas to be able to vaccinate them at their areas. In addition to focus on the equity, we're focused on ensuring that those with disabilities also have the ability to get vaccinated. Since January 20th, we've continued to grow the vaccine supply. So in addition to sites like this, we've now grown the vaccine supply over 70% to 15.2 million doses per week. And that's a 77% increase since January 20th. In addition to that, we provided over 2 million vaccines to pharmacies to reach more of the population through pharmacies. And then we're focused on vaccinating directly to the skilled nursing facilities and long-term healthcare facilities. So it's an all-hands-on-deck effort as part of the strategy to vaccinate everyone. One other thing I'd like to mention is, as part of FEMA working with DHS has said we will not conduct any immigration or enforcement acts at CVC sites or healthcare facilities across the United States during this time. And that's important because we want to make sure that people feel comfortable come to these sites and getting vaccinated. And then lastly, in closing, I would just like to say the Biden administration is committed to vaccinating everyone, especially those that are most vulnerable in the United States, that everyone has a role in getting vaccinated. And then lastly, continue to be safe, wear a mask, continue to social distance, and get vaccinated. Thank you. I'll be followed by Major General Neely. Thank you.
Well, good morning. And thank you for joining us today. It's a real honor to be here with Governor Pritzker, the acting administrator for FEMA, Fenton, Cook County President Preckwinkle, the Mayor Lightfoot, State Senator Van Pelt, State Representative Williams, Commissioner Deere, and of course Alderman Burnett, as well as most of our other local leaders that are here today joining us. This is really an incredible day and a great opportunity for Chicago. Throughout this pandemic, almost at a year right now, you've seen this uniform throughout the state of Illinois. Actually, in fact, throughout the nation, as the National Guard has responded in many different ways in support of this pandemic. Of course, the most recent response that we've come up with is this vaccination mission, this COVID-19 vaccine that's so important to returning our communities back to normal. In the last 2 months, the Illinois National Guard has activated more than 1,300 airmen and soldiers to support these vaccination missions across the state of Illinois in 60 different locations, 20 of which were mass vaccination locations and 40 other mobile locations throughout the state of Illinois. From the most northern parts of the state to the southern 7 counties, the Illinois National Guard is spread out throughout the state. With the continued increase of vaccine availability, it is so appreciated today to have 222 active duty brothers and sisters joining us here today from the 101st Airborne Division to set up this new location here in the city of Chicago, the most recent mass vaccination location here in Cook County. This location, as was previously mentioned, should be able to vaccinate up to 600 immunizations, provide 600 immunizations per day. As the Adjutant General, I've assigned one of my generals, Brigadier General Jim Silvasi, to be over this vaccination location as well and work hand in hand with the active duty members as well as our National Guard soldiers and airmen throughout the state to ensure a unity of effort is provided for this location. And the active duty team here has everything that they need. He will be working closely with the commander for the 426 Brigade Support Battalion, Lieutenant Colonel DeBello, that's here on location. With the command arrangement, along with coordination with FEMA, the Illinois Emergency Management Agency, and Director Tate Nadeau, Illinois Department of Public Health, Dr. Zake, Cook County, the City of Chicago, and all of the local community officials, I believe this is one of the best examples of a whole of government approach, and in fact a whole of community approach as we all come up and fight this vaccine. We look forward to continuing to increase our participation in this vaccination mission as more vaccine becomes available and ensure that we're able to vaccinate all of our citizens of the state of Illinois. And with that, I'll pause and turn it over to Cook County President Tony Preckwinkle. Thank you.
Good morning. I'm pleased to be here today as we open the United Center Federal Mass Vaccination Center in partnership with FEMA. I'd like to acknowledge the elected officials and public health leaders who've joined us today. Thank you very much, Governor Pritzker. Acting FEMA Administrator Bob Fenton Jr., Kevin Sly, our Region 5 leader, Chicago Mayor Lori Lightfoot, Cook County Commissioner Dennis Deere, who is chair of our Health Committee, State Senator Patricia Van Pelt, and our 2 state representatives, Jahariel Omar Williams and State Representative Lakeisha Collins. Thank you. Welcome, State Representative Collins. My friend and former colleague, Alderman Barnett. I'd also like to acknowledge Israel Rocha, who's the CEO of our health and hospital system. Major General Richard Neely, we're deeply indebted to you for your help and support of a variety of our sites in Cook County. I also want to acknowledge Brigadier General Jim Silvasi of the Illinois National Guard, Director of IEMA, Alicia Tate Nadeau. I'd like to thank Rocky Wirtz and Michael and Jerry Reinsdorf for their collaboration and support of this facility. I'd also like to acknowledge our public health leaders, Dr. Ezike, Dr. Awardi, Drs. Rubin and Joshi. And I'd like to thank our sign language interpreters, David Jones and Izzy Rangel. This would not be possible, this site would not be possible without the support of President Biden and his administration. I'm so grateful for their leadership as we navigate our vaccination programs throughout the county. Tomorrow marks 1 year since I issued a disaster declaration in Cook County as we saw an influx of COVID-19 cases. It's impossible to overstate the pain and tragedy that has occurred in the past year with so much loss of life. More than 500,000 Americans. But today I have hope for the future. As we open this site, all of the 110,000 initial appointments are already booked. 110,000 appointments already booked. We understand that this is still a small percentage of the state, county, and city population, but that's 110,000 people who can protect themselves, their families, and their communities. In planning for the site, Governor Pritzker, Mayor Lightfoot, and I have made sure that equity was at the front and center of the process. Not only is United Center a large venue with the capacity to quickly move lots of people in and out, but it's also an accessible location for many residents in vulnerable communities, the same communities that have been disproportionately ravaged by COVID-19. We know that many communities in the city of Chicago and Cook County, which have been hardest hit by the pandemic, also have the lowest rates of vaccination. I'm going to say that again. We know that communities in Chicago and Cook County, which have been the hardest hit by the pandemic, also have the lowest rates of vaccination. Last week, President Biden said that he believes that every American adult who wants a vaccine will be able to receive one by the end of May. Believe me, I look forward to that day. I'm proud of the progress we've made in our vaccination programs and have enjoyed visiting the sites around the county. Each time, I become a bit more hopeful. Now I'd like to introduce the Mayor of the City of Chicago, Lori Lightfoot.
Good morning, everyone.
Good morning.
And thank you, President Preckwinkle, for your words. I also want to extend my thanks and gratitude to Governor Pritzker. From all of our teams, the governors, President Preckwinkle, and the mayor's office have been working really diligently for weeks now with FEMA and with IEMA to make sure that this day was possible. So let me also thank Acting FEMA Administrator Bob Fenton Jr., who's representing the Biden-Harris administration, and as other speakers have said, this day would not be possible but for this new administration's commitment to making sure that we right the wrongs of the past year and get vaccine to cities and towns across the country where it is desperately needed. Thank you, Major General Richard Neely of the Illinois National Guard and your whole team who has done heroic work all across our state, here in Chicago and Cook County. Let me also recognize Cook County Commissioner Dennis Deere, Dr. Israel Roca of the Cook County Health System, IEMA Director General Tate Nadeau, Illinois State Senator Patricia Van Pelt, State Representatives Omar Williams and Lakeisha Collins, and Alderman Walter Burnett. I also, of course, have to give a thanks to Dr. Ezike of the Illinois Department of Public Health and Commissioner Allison Arwady of the Chicago Department of Public Health, and welcome other distinguished guests. Little less than 2 weeks ago, we came together to share an exciting announcement that our beloved United Center would become our newest mass vaccination site, allowing us to vaccinate 6,000 people per day and increase our current capacity by over 40%, with the first appointments available exclusively to seniors 65 years and older. And this hyper-focus on supporting our seniors stemmed from some troubling data that we were seeing. Here in Chicago, we had 250,000 seniors who still needed their first dose, and if you look to the entirety of Cook County, that number swelled to nearly 500,000. In order for us to truly rise and recover from this pandemic, we knew that we had to continue to push vaccine to residents that need them most, especially those 65 and older, as fast as humanly possible. That's why we are thrilled to announce that starting today, the United Center vaccine site is officially open, and we'll begin to vaccinate more than tens of thousands of Illinois seniors who secured appointments since registration opened last Thursday morning, as well as those who will meet new eligibility requirements. Following additional conversation and authorization from FEMA, appointment eligibility for the United Center site was recently opened up to better ensure equitable vaccine distribution. And we will be better able to target Chicagoans most in need of this life-saving vaccine. By the time that authorization came on Sunday afternoon, more than 40,000 Illinois seniors had secured appointments. However, less than 40% of these appointments were made by Chicago residents, a percentage that is at odds with the equity-based and inclusion-driven reasons behind why the United Center was selected as a vaccine site in the first place, as you heard from Acting Administrator Fenton. As a result, appointment access now has been focused to Chicago residents and Cook County residents and state residents who are eligible for the vaccine under Phase 1B+, which includes anyone 18 and over with underlying health conditions, and our continued focus on seniors 65 and over. Appointments will be set aside for residents who live in high COVID Community Vulnerability Index neighborhoods, or CCVI zip codes, and zip codes with low vaccination rates. And appointment blocks will be provided to community-based organizations for targeted outreach for special populations in Chicago, including residents with disabilities. And I want to emphasize that this site was designed with disability in mind. We were intentional about making it fully accessible so that anyone with a disability would be able to get a vaccine in comfort. And I want to thank Chris Shields of the Chicago Department of Public Health and his team for their unrelenting focus on disability and making this site a model for the nation. These efforts will support our ongoing Senior Month programming, which includes a series of vaccine events in 11 communities that rank high on our CCVI index. Our efforts also include partnering with the Chicago Fire Department to administer vaccines to homebound seniors and their caregivers, and dispatching mobile vaccination teams to independent senior living facilities. Taken together, the United Center vaccine site and our city's Senior Month programming will allow us to continue making huge strides towards ensuring full equity in our vaccine distribution efforts. We here in Chicago are extremely proud of the vaccine accomplishments that we've made thus far, and come a long way from those early days when we were seeing inequitable uptake in vaccines. And in the last week alone, we got no less than 97% of vaccines into the arms of residents within 7 days of receiving them. And thanks to our equity-based vaccine strategy and initiatives like Protect Chicago Plus, 59% of doses went to Black and Latinx Chicagoans in our last week. Folks, that is a major accomplishment and turnaround from where we were. Here in Chicago, 59% of our residents happen to be Black or Latinx, meaning we have made great progress on our goal of delivering a majority of vaccine doses to our residents of color. These incredible accomplishments don't stop here and didn't come easily. In the last month, our case rates have been more reflective of city demographics, as we've seen major improvement in cases among our Latinx residents for the first time in over a year, after a significant amount of effort on the part of many. This is a result of a lot of hard work by many starting last spring, from our work of our racial equity rapid response team to community-based federally qualified healthcare centers and other community-led convenings like those led by Alderman Mike Rodriguez. We also want to thank our many private sector partners like Uber, who I want to thank for not only hosting the walk-in vaccination site with their Uber zone, but also providing 20,000 free rides to and from this site for Chicagoans in need of help, also helping us close the equity gap in vaccinations by eliminating transportation barriers that far too many in our city face. We also need to lift up and thank the United Center leadership, the Reinsdorfs and Wirtz families who have gone above and beyond throughout the pandemic to allow the United Center to be used as a hub for meeting the needs of residents during this difficult time. And I want to specifically note Michael Reinsdorf, who is here with us today representing the United Center leadership. So thank you to Jerry and Michael, Rocky and Danny, and your respective teams. We could not ask for better partnership and true civic engagement, so thank you very much for all that you've done throughout the pandemic. We will also be giving guidance soon about additional appointments opportunities here at the United Center, and we are excited to get started with the vaccinations here today, which should have started about an hour ago. I'm also calling on everyone to help their friends and families and loved ones get to this site, to get them an appointment, whether it be here at the United Center, a pod site, or temporary vaccine, or a vaccine event. And be prepared to sign up your vaccine appointment, to show up for your vaccine appointment when it's your turn. For more information about COVID vaccines across the city, please visit chicago.gov/COVIDVax. That's COVIDVAX. What we do now determines how equitable and inclusive our post-COVID recovery will be. That's why we must continue to do everything in our power and work together to blunt this crisis. And as I close, I also want to take this opportunity to depart from script and publicly thank two people who worked tirelessly over this long, hard year through some very desperate and difficult times. They have been our anchors, our support, and have given us hope when at times it seemed really hard to come by. So please, everyone, join me in giving a round of applause to Illinois Public Health Director Ezike Ngaze and Chicago Department of Public Health Commissioner Allison Arwady. Ladies, we have stood on your shoulders. You have carried us through a really difficult time. And I know on behalf of a grateful city, a grateful state, and people that I hear from across the country, they have been looking to you for leadership and for strength and for hope. So keep fighting that fight. We're here with you to support everything that you're doing. And with that, it's my pleasure to welcome Senator Van Pelt to the podium. Thank you.
I'm Senator Patricia Van Pelt, and I'm the senator for the 5th District, and I'm just here to celebrate what is happening in this space. It took all of these levels of government, including the private sector, as far as the Reinsdorfs are concerned, to bring this all together, to have a space where we can actually get these vaccinations out in a big way. So I wanted to thank President Biden and also FEMA. I'm also want to thank our very fine governor, Governor Pritzker, our Cook County President, Preckwinkle, and also our mayor of this city, Mayor Lightfoot. And Mayor Lori Lightfoot went over so much, and I felt like she said everything that I wanted to say. So I'm not going to repeat the things that she said, but I want to just say that I am grateful, 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 grateful to every single one of you that have taken this time to help our community. I mean, this could have been put somewhere out in the suburbs, but no, it was brought here in the middle of this West Side community where there is a great, great need, where so many people are being left out. And one of the things that moved me today when I read in the Crane's news that when you all notice that the people that were getting the vaccines, over 60% that were signing up were coming from outside of Chicago, you put a halt on everything and said, no, this is about equity. This is about justice. This is about freedom, and this is about access. And you said, wait, we're going to stop it right here because we want to be sure that the people who are being left out the most often, that are left out the most often, are the ones that actually get access to this vaccination. And then they went on to begin to bring us all together for this moment, for this time. I want to just share my gratitude to you for having that in your heart, because so often I've seen them say next time, we'll get it right next time. You know, this time, you know, all the vaccinations went out to the people who we didn't expect it to go to, but next time we're going to get it right. But you all said this time. You said this time. This time. And I tell you, I feel I'm celebrating inside. Because I have not touched my mother in over a year. I'm only able to see her through a plastic barrier. Finally, with the vaccinations, I'm going to be able to hug my mother again. I'm going to be able to kiss her again. I'm going to be able to reach my grandchildren again. We will defeat COVID. We're defeating COVID, y'all. We're defeating COVID. And we're doing it together in an equitable way. And I am so proud to be alive in this point, in this time in history. So I can see this, and I can carry this message to the next generation, and the next generation can carry it to the next generation that says there is no healing a part of the nation with a little corner of sickness in the corner. We have to heal the whole group, the whole body, the whole city, whole state, the whole country, the whole world. And I'm excited about being here to see it for myself. God bless you all. God bless you. And I'm going to call right now, our next speaker. And our next speaker is Representative Jawaharlal Omar Williams. And he is the committeeman for the 10th District. Receive him now.
Representative Collins, would you like to come with me as well? Come on. Good evening, good morning, everyone. My name is Jawaharlal Omar Williams. I am the state representative of the 10th District, and this is part of my district. I don't want to also bring up Lakeisha Collins as well. We share part of the district as well. And I'll do a little speaking before because we wasn't really prepared to speak, but I'll share what she feels the same way. Thank you all, everybody who's participating, from the doctors to the elected officials to the wards, the Reinsdorf, go Bulls, go Hawks. Thank you all. Basically, I'm going to say thank you all for bringing this to this community as well. This is my district, but a lot of this district helps people of color. It's an easy access. We can catch the Ashland bus to get off the 290 expressway, and we need these resources. But one of the things I really want to say is that everybody out there who's listening, please take the vaccination. I know the history throughout the United States with people of color were taking tests or government administered tests. Those were the times in the past. These are new times. I've taken the test, and I encourage everyone else to take the test. Let's get the test. Let's protect ourselves. Let's move forward so we can go back to normal times, whatever normal times may look like. So on that note, I just want to say thank you all.
Well, I get to introduce him. Well, it's my pleasure to introduce our commissioner, chairman of the health committee for the County of Cook, Dennis Deere.
Thank you, Mr. Governor. We have so much to be thankful for today. So whenever I speak, I always start out by saying God is good and all the time. All right, thank you so much. It is a blessing to be here. Thank you, Governor Pritzker. Thank you, Acting Director of FEMA, Bob Fenton. Thank you to the General, Richard Neely. Thank you to my wonderful mentor and President Preckwinkle. Thank you to Mayor Lightfoot, Senator Van Pelt, Representative Collins, Representative Williams, Alderman Burnett. These are all my partners in good government. Dr. Ezeke, Dr. Rubin, Dr. Josie, Dr. Arity, and Israel Roca, who is our CEO of Stroger Hospital. This is about equity. This is about making sure that though everybody is vaccinated, but those who are hit the hardest, that they get vaccinated as well. This is the 2nd County District where we are sitting in, and I was so happy to hear about the United Center being a vaccination site. You know why? Because East and West Garfield is a little bit north of here. A lot of those people are disadvantaged. They were hit hard by COVID. And guess what? With the same strength that they were hit with COVID, we're able to hit them with the vaccination. I'm thankful for that. North Lawndale, where I was born and raised, is not far from here. Same thing took place. Many individuals who are underserved are actually going to be able to get the vaccination. I want to take an opportunity, since it is Women's History Month, when they got up and named all the people who were leaders for this vaccination effort, guess what? 75% of them were women. So let's give a round of applause in honor of Women's History Month for all of these women who are doing such a fantastic job. We applaud you and we thank you. As I take my seat, I again want to say it is important to all of those who are on the fence about getting vaccinated, get vaccinated. I'll end with my favorite quote. Socrates said it, if you always do what you've always done, you're going to always get what you always got. Socrates said that. The next one is a deism. That means I made it up. In order for you to get something you never had, you got to do something you never done. Get vaccinated. God bless you. I'd like to bring up my good friend and partner in good government, Mr. Alderman Walter Burnett. Come on, brother.
Thank you very much, Commissioner. Just following up on where Reverend Van Pelt started. She is a reverend for real. I just want to say praise God. Hallelujah. Thank you, Jesus. You know, a lot of us have been praying for this day. A lot of us have been praying that God would give us a vaccine that will help us to be able to overcome this plague that has hit our world, that has killed so many people in the world. So we're just grateful to God that he has answered our prayers. But God wants us to pray, but then he wants us to get up and do something. So he gave us the vaccine. Now he wants us to take it. He wants us to take the vaccine. Those of you who have prayed for this, those of you who mourn your family members who have been lost, those of you who are concerned about your parents and your kids, we need to take this vaccine. You know, it's so many African Americans aren't taking it for whatever reason. There's a rumor out right now that they putting a chip inside of you. You know, that's the rumor. Let me tell you, if you got a cell phone, they got a chip with you anyway. So y'all should throw away your cell phones right now, if that's what you're worried about. They got a chip in your car. If you got OnStar in your car, they got a chip in your car. Get rid of your car. That's insane. That's insanity. We need to get this vaccine so that everyone around us can be healthy. It's not just about you. It's about everyone you come in contact with. Coming back into this country from around the world, they won't let you get on the plane unless you had a shot. You got to prove to them to have a shot. I guarantee you, sooner or later, they're probably not going to let you get on the plane unless you had the vaccine. Sooner or later, some churches are going to say you can't come in church unless you had the vaccine. Some institutions are going to say you can't come in here unless you had the vaccine. Some jobs are going to say you can't get a job here unless you are safe and you don't put the rest of the people that work here in jeopardy unless you had the vaccine. If you want freedom and if you want social justice, take the vaccine. Take the vaccine. It's important for all of us. We're all in this together. If one of us are clear of the virus, it helps the rest of us to be clear of the virus. God bless you all. Let's continue to pray. I'd like to thank all of the elected officials who've been putting this together. I'd like to thank all of them for coming together to make this work. I'd like to thank all of the doctors for keeping us focused on the science, right, and not on the rumors. You know, thank God we got rid of the rumor guy who was up there saying bleach and all that other stuff. Thank God we got rid of him. But also, would be remiss if I did not thank this president, FEMA and his whole team. Thank God for President Biden. Thank God for all the people who voted for him so we can get some sense in the White House, so we can get the resources that we need in our city, our county, and our country, you know, so that we can, you know, be the ally to all of the people around the world that we have been for many years. We're just so grateful. All of the money that they're putting in place right now to help the cities, the states, and the counties with these relief funds, I mean, it's detrimental. We really need it. So we are so grateful for everything that God has blessed us with. We were praying that we get some relief. So I just want to say again, to end on this, we thank God. Hallelujah. Thank you, Jesus. Now, be my pleasure to introduce the governor of the state of Illinois for questions and answers. So I have a first question. I'm just kidding. Go ahead. Governor J.B. Pritzker. Thank you.
Thank you very much, Walter. And I just
good morning. Over here.
thank you.
Technical questions I might have misunderstood. How many open at this? How many? How does state?
So I think although the PA was cutting in and out, I think I heard you. You wanted to know how many are available, how many appointments are available, how many have already been signed up. Is that the question? I think I'd like to turn it over to either the mayor or the FEMA administrator, because I don't have the latest tally.
So I'm looking at Dr. Ari. I believe that there are 40,000 people that have signed up so far, and we are assessing what the equity numbers look like before we open it up, and we'll give further details later this week about how it is that people can sign up. And these are dispersed, continuing with city, county, and state. But we are adjusting the numbers based upon what we see in terms of the appointments, what zip codes folks are coming from, and other demographic information. You know, as the acting administrator said, we have to do this in a way that is consistent with equity. And that's critically important. So we are all working together. Our teams are working together on a daily basis and looking at the numbers to make sure that we get that right.
Sorry, can we just get clarification on that? Because I think somebody had said 110,000 appointments. I don't know if it was perhaps...
In total.
So can you kind of just take us through all of that? We're wanting to, of course, get accurate. 110,000 total appointments as of now have been taken.
No. Let me back up.
Okay.
So it's 110. We anticipate 110,000 in total through the duration, and so that's first dose and second dose. It'll be 110,000 people that are able to access the site. To date, we have about 40,000 people that have signed up. So hopefully that clarifies it.
And that does not yet include people from the suburbs who are going
No.
to be getting
No,
appointments through
it
this
does.
special route?
It
or
does. The 40,000 is a mix of Chicago, suburban Cook, and state.
Thank you. Mayor, so just to clarify a little bit more, because there's just been so much confusion with
Yeah.
this. Right now, the site is down, correct? So right now, there are no new appointments that can be made at the United Center. When
Right.
is that expected to change?
Later this week.
Later
Later this week, we'll be issuing specific guidance. Again, as I said, it's really critically important. Look at where we are. We're here on the west side in a majority black neighborhood in the city of Chicago. From the very beginning of Chicago and for Cook County's efforts, as well as the state, we've been very focused on making sure that we get the vaccine to those individuals in neighborhoods and zip codes that have been most dramatically hit by COVID-19. We want this to be the focus of this site. And for a variety of reasons, we had concerns about whether or not those appointments were being given out in ways that are equitable. And as I said in my prepared remarks, we have adjusted through conversations among the state, the county, and the city. And so we're going to then have a renewed focus, and I'll just speak for the city, and making sure that we're hitting those zip codes where equity is a real challenge, where we haven't seen the kind of uptake. We're going to be working with our federally qualified healthcare centers. We're going to be working with elected officials, community-based organizations, so that we really bring people out that really need the vaccine most desperately, both here at the United Center, but also across our city pods and other distribution opportunities.
If I may just follow up, you say that it'll open up again later this week.
Mm-hmm.
Is that later this week just for city residents?
No.
Or no, other people will be added
Correct.
as well? And then you had also mentioned in your prepared remarks that there would be appointments set aside.
Mm-hmm.
So that'll be outside of the reservation system.
No,
appointment blocks
that'll be from, I was speaking specifically to the city portion of the reservations. As I said, we want to make sure that we are doing very targeted and very focused on bringing people from those neighborhoods and zip codes that have been so significantly challenged throughout the pandemic around infections and deaths, and make sure that those residents, you heard, I think, really compelling testimony from, I'll talk to Alderman Burnett. We've got to get people vaccinated. We've got to get people of color vaccinated. We've got to get people who are 65 and older and with underlying healthcare conditions. If we vaccinate that population and really focus on them, we are going to have gone a long way in mitigating the spread of the virus. We have to focus on our most vulnerable residents. Doing that not only makes sense from an ethical and moral perspective, but it follows the science. When we get those people vaccinated, we control the spread and we provide support for everyone else. So that's got to be our focus.
Thank you. Good morning, Mayor. I have
Good
a
morning.
question for Governor Pritzker. I have two questions. Is that all right? Quickly, it's almost been a year since the flag has been at half staff. And, when we were kids, we didn't have cell phones, the internet. We would know if somebody significant passed away when the flag was lowered.
Yeah.
When are you going to be raising it? Because now, we had 5 COVID deaths in the entire state yesterday, with its good news. Our positivity rate is below 3%. What's the metrics that you're using in order to raise the flag?
Well, let's start with I didn't realize you were old enough that you can remember a time before cell phones.
Yes.
So that's helpful for me to be able to measure my own age against. Let me say that we lowered the flag to half staff because we're in the midst of the worst pandemic that this country has ever seen, and so many people were dying on a daily basis. We continue to have deaths all across the state, and things have gotten better. It's true, but and so there's no doubt there's contemplation of when is an appropriate time to raise the flag from half staff. Certainly have heard that before. I guess I would say that I want to make sure, whether it's the flag or in some other ways, that we do remind people that this pandemic is not over yet, that we're going to be in this for months, and we don't know how long the vaccines last. We don't know if when you're vaccinated, will you have to get vaccinated once a year, or will it be once every 2 years, or perhaps a shorter period of time? We still don't know that. We need to continue to have testing all across the state, and we need to continue to worry about the variants that are here now, although the most dangerous ones seem to be covered by the vaccinations that we have available, but there may be other variants that develop, as you've seen. And so we take all that into consideration. I, like you, revere particularly our members of our military who pass away and want to make sure that we honor them appropriately. So we can take that all into consideration, and we honor them in so many different ways. The flag is only one of them.
Okay, and then also, I know you're not under investigation, but as you know, Governor Cuomo is under investigation for nursing home deaths. Do you know how many nursing home patients who were infected were returned to retirement homes or to nursing homes?
I don't, but let me just point out that we never put in place an executive order that forced people to be put back into nursing homes, as you know. That was not something that we contemplated. Having said that, I don't know how that investigation will turn out. One thing I know is that all the data that we have available to us in our Department of Public Health, as we have been able to put it out to people, we have put it out.
Hi there, I'm calling with Blog Club Chicago. A few questions from our editors. First is for Mayor Lightfoot. We just wanted a little bit of clarification on the numbers that you presented us today. Just, the 40,000, just to make sure we have all of our numbers correct for availability for vaccinations. The next question is, does asthma count as an underlying condition for 1B and 1C currently? And I'll start with those two questions. I've got one more after.
Okay. I'm going to turn to Dr. Arity, who will answer this.
Just to clarify, because there's been a lot of moving pieces here. So as folks remember, when we initially opened, our major focus from the beginning and now remains getting people 65 and plus vaccinated. We had approximately just under 40,000 people register who were over 65 from across Illinois. That was open to everybody over 65 in Illinois. Everybody is in agreement. That's who we most want vaccinated. At that point, there, as you heard, were a relatively less than 40% of those registrants came from within the city of Chicago, and we had some concern about the equity data that we were seeing. And so there was a decision made among the county, the state, and the city in cooperation with FEMA to really take a much more focused equity approach to the remainder of these vaccines. We're extremely focused, for example, on making sure that we can continue to get people over 65 appointments here. And that means not just broadly opening it up to everybody. And so in the latter part of Sunday, honoring the commitment that had been made previously to open appointments to people with underlying conditions, there were a limited number of appointments in the vicinity of around 10,000 that were made only for City of Chicago residents. And ZocDoc.com remains the public-facing platform for City of Chicago residents to be able to get vaccine, as well as the call number that we shared previously. Right now, there are not publicly facing appointments available because everybody at the city level, the county level, the state level is working to do additional outreach, additional work with the hardest hit communities to make sure that they have some more targeted ways to sign up for appointments. We're doing some of this outreach to work with disabilities, etc. If for City of Chicago residents, if you are in one of these zip codes, if there is this, there will be additional outreach, there will be ways to sign up. We're going to have more of that to come and sharing some of those details. But for everybody in the City of Chicago, you can continue to watch ZocDoc.com. There are, again, not significant appointments available right now, but if there are cancellations, that's where they would show up. I would expect a few intermittent cancellations. There have been appointments set aside for suburban Cook County, and they are, again, doing that preliminary work and outreach to make sure the majority of those appointments can be taken by people who most need this vaccine. And then similarly, there are some efforts with the state, I believe mobile efforts to bring some of the vaccine to the parts of the state that have also been hardest hit. And so there's been some division behind the scenes of vaccine. The majority of vaccination appointments do remain available here at the United Center. It's in the 50,000-ish range that has been completely filled, the 40,000 with the seniors, the additional 10. And over the whole time of this United Center operation, it's more like 185,000-ish that will be able to get appointments. We'll be bringing in drive-through, we'll be bringing in additional operations. On purpose, we did not make all of the appointments available from the beginning. The whole first week of vaccinations is entirely booked. The second and third weeks are sort of partially booked. Of course, the drive-throughs coming in. So there will be more details coming. Again, as always, when we open up, I urge patience. People will have the opportunity to get vaccine, but everybody's not going to be able to get vaccinated at this site, and we want to ensure the majority of the remaining vaccine doses. Obviously, if you're 65 plus, you're in. Other than that, we want to have a focus on the zip codes that are of highest need.
Oh, I still had, you didn't answer a question I asked about whether or not asthma will be considered in 1B and 1C.
Sure. So there are some detailed guidance that are out available. We are following along with the state guidance. It does not specifically mention asthma in that 1B+. Again, this is the highest risk people. So it talks about COPD, for example, some other very highest risk, immunocompromised. Once we move into 1C, which we do expect to do here in Chicago at the end of March, asthma would then be included.
Thank you.